ASH is expanding its leadership in health equity through a major effort to improve care for individuals with the Duffy null phenotype. ASH is preparing updated and evidence-based Duffy-specific and reference ranges for adults and children.
So these new reference ranges will improve care by making sure we define normal appropriately for all the patients that we're serving. We think that this will minimize things like referrals to hematology for people who are actually healthy, will minimize unnecessary testing, may also allow for things like increasing adherence to medications like clozapine or azathioprine that are dosed by neutrophil level. ASH has also put out guidelines with a strong recommendation to obtain Duffy testing in all clinical trials. This will help with increasing eligibility for clinical trials. It will also really help us understand the impact of Duffy status on how people do in a trial, how they respond to certain medications, what their overall survival is, what the progression-free survival is. And it's a really critical way for us to gain more information so we can have more specific recommendations on the best treatment for patients with Duffy null status and Duffy non-null status. The next steps for implementation are making sure that we spread the word, that we have these new Duffy null ANC and white blood cell reference intervals. We have a guide that we're hoping to publish soon as a roadmap for other institutions to learn how to verify these reference intervals and also implement them in their own sites. This might include things like making it easier for clinicians to order Duffy antigen testing, putting some guidelines in the reference intervals on what's normal for people by Duffy status, doing some education campaigns, including things like changing referral trees, and many more ideas that a lot of sites are exploring to try to make sure that these reference ranges we developed are usable and obtainable as well.